Hey everyone, and welcome to this deep dive. We're going to be looking at functional medicine today.
Okay.
It's something that a lot of you have been asking about, and we're going to be going through this interview with Dr. Will Cole
Right.
from the Perspectives on Healthcare podcast.
Yeah. I mean, one of the things that really stood out to me with Dr. Cole's approach was
Mm,
this whole idea that functional medicine is about finding the why. It's not
right.
just putting a name to the what.
So
It's
good.
really trying to get down to the root cause instead of just.
Totally like detective work almost.
Yeah, exactly.
Yeah, instead of just managing the symptoms.
Exactly.
Yeah, and he says this really great thing. I think he says, nobody gets healthy by taking enough Lipitor.
Right.
And it's not that medication isn't valuable or doesn't have its place,
Right.
but it's often a Band-Aid. And in your experience, what are some of those underlying causes that are often overlooked, in a conventional medicine approach? And how does functional medicine approach those differently?
That's a great question.
Yeah.
I think a big area where functional medicine diverges from conventional is in how they interpret lab results.
Okay.
So instead of just looking at average ranges,
Yeah.
functional medicine practitioners are really focused on optimal ranges,
Yeah.
recognizing that what might be considered normal, quote unquote,
Right.
may not actually be
Due
ideal
to every individual. Yeah.
for every individual, for that particular person.
Can you give me a concrete example of what that might look like?
Sure. So let's say you have someone whose thyroid stimulating hormone level, their TSH,
Mhm.
falls within that normal range on a lab test,
Okay.
but they're constantly battling fatigue.
Right.
A conventional doctor might just dismiss their symptoms.
Oh, it's in the normal range, so you're fine?
You're fine,
Yeah.
but a functional medicine practitioner would dig deeper,
Yeah.
Look at things like nutrient deficiencies,
Okay.
stress levels,
Yeah.
gut health,
Yeah.
all these things that could be contributing to that fatigue, even if the TSH isn't technically abnormal.
That makes total sense. Yeah, it's about looking at the whole person, not just a set of numbers.
Absolutely.
And I feel like this leads really well into another concept that Dr. Cole talks about, which is the inflammation spectrum.
Yes.
And I think this was so interesting to me because, I always thought of inflammation as like that acute thing, after a tough workout or,
Yeah.
if you have an injury.
Right.
But he's talking about this low-grade chronic inflammation that can be kind of
Right.
under the surface. So how do we become more aware of those more subtle signs
Yeah.
and understand how they connect to chronic diseases down the line?
Well, that's exactly what Dr. Cole was talking about, was
Yeah.
that, these chronic illnesses, they rarely just appear out of nowhere. They
Right.
kind of simmer beneath the surface for years,
Mhm.
often starting with this low-grade inflammation we might not even notice.
Right.
He even cites research estimating that it can take 4 to 10 years
Wow.
for those chronic health problems to develop before a diagnosis is even made.
So by the time, somebody's diagnosed with something like diabetes or heart disease,
Yeah.
it's been brewing for a while.
It's been going on for a while. Yeah.
That's definitely a wake-up call to start paying attention.
Absolutely.
So what kinds of signs should we be looking out for?
Well, this is where things get interesting.
Okay.
Because Dr. Cole believes that a lot of these common symptoms that people experience that are often just dismissed as, part of getting older,
Right.
could actually be red flags for this chronic inflammation.
Okay.
So things like persistent fatigue,
Right.
brain fog,
Mhm.
digestive issues,
Yeah.
even stubborn weight gain,
Yeah.
all of these things that we kind of just accept as part of life
Right.
could be signs that something's off.
Okay.
And he suggests really tuning into those seemingly minor issues
Yeah.
rather than brushing them off.
So it sounds like functional medicine is very proactive
Yeah,
in terms of prevention and early intervention.
absolutely. And speaking of prevention,
Yeah.
Dr. Cole is a huge proponent of the power of food as medicine.
Food is medicine.
Food is medicine.
Hmm.
He believes that every food we eat
Yeah.
either contributes to or combats inflammation in the body.
Okay.
And he says there are no neutral meals.
Okay.
He famously declares there's no Switzerland meal.
I love that.
Yeah, and he truly believes that conditions like diabetes, heart disease, even autoimmune disorders
Yeah.
are heavily influenced by what we eat.
That's a bold statement.
It is.
And it really challenges our assumptions about the role of food in our health.
It does.
He's not saying that we all have to become perfect eaters overnight,
Right.
but rather, to just become more mindful
Mhm.
of the impact of our dietary choices
Absolutely.
on our well-being.
Right.
It's like food can be medicine.
It can be.
Every bite we take either nourishes or harms us.
It's powerful.
So he's not advocating for any particular diet.
Right.
He's more about just encouraging people to become more aware of
Exactly.
how different foods make them feel and to kind of personalize their approach.
Yeah. Find what works for them.
Now, I know Dr. Cole's also not afraid to critique the
Yeah.
conventional healthcare system.
Right.
And, he expresses concerns about time constraints on doctors,
Mm-hmm.
lack of focus on nutrition
Yes.
in medical training, and a tendency to just rely on medication.
Yeah.
Um, and he kind of suggests that the current system is really geared towards disease management rather than true health optimization.
Yeah, I think that's a really key point.
Yeah, but isn't there a place for medication in addressing root causes?
Yeah.
How does he see that balance?
Well, I think you're right. He's not advocating for throwing out Western medicine altogether.
Right.
I think he believes medications have their place, but he emphasizes that they should be used strategically alongside lifestyle interventions
Okay.
to really address the underlying cause.
Address the underlying cause.
Or not just mask the symptoms.
Right.
He's a strong advocate for what he calls an integrative approach,
Okay.
combining the best of conventional medicine with these functional medicine principles.
So it's not about one versus the other.
Right.
It's about creating a more holistic and personalized approach.
Exactly.
Yeah. I'm curious about this integrative approach, though. What does that actually look like in practice?
Yeah, so in an ideal world, it would involve open communication and collaboration
Okay.
between conventional doctors and functional medicine practitioners,
Okay.
working together to create a comprehensive plan
Yeah.
for that patient.
That's tailored to them.
Exactly.
Yeah.
Sometimes that might involve medication.
Mm-hmm.
Other times it might focus more on lifestyle changes like
Right.
diet, exercise, stress management, even addressing environmental factors.
Right.
So it's really about finding the right tools for each person.
Okay, that makes a lot of sense.
Yeah.
It sounds like he's calling for a major shift
He is.
in how we think about healthcare.
He is.
It's not about waiting for things to break down.
Right.
It's about being proactive.
Yes.
Taking steps to optimize your health,
Absolutely.
prevent disease.
Yeah, and what's really encouraging is that Dr. Cole isn't pessimistic about the future of healthcare.
Okay.
In fact, he's quite optimistic,
Interesting.
particularly about the increasing access to information
Okay.
and the growing popularity of these alternative approaches like
Okay.
functional medicine. He sees this as a democratization of health information.
So it's not this model where the doctors are the only ones with the knowledge.
Exactly. It's
Yeah.
shifting to where patients are actively engaged in their own healthcare decisions,
Okay.
and they're empowered to take control.
I like that.
Yeah.
But I also wonder, with more information available,
Mm-hmm.
doesn't that also come with the risk of misinformation spreading?
That's a really important point.
Right? Like, how can people ensure that they're getting accurate information,
Yeah.
evidence-based information?
Well, Dr. Cold really stresses the importance of critical thinking,
Okay.
questioning everything,
Yeah.
seeking out information from reputable sources.
Okay.
He encourages patients to have open conversations with their healthcare providers,
Yeah.
to do their own research, to be
Mhm.
really discerning consumers of health information.
That makes sense.
And he also believes that as functional medicine gains more mainstream acceptance,
Yeah.
that we'll see more rigorous research
Okay.
and evidence-based guidelines emerging,
Okay.
which will help to separate fact from fiction.
Yeah, weeding out the
Yeah.
not so good information.
Yeah, exactly.
That's reassuring.
Yeah,
Yeah, it sounds like functional medicine is still evolving.
it is.
But there's a lot of excitement and momentum building around this.
Absolutely.
And he even points out that practices that were considered radical just 12 years ago
Yeah,
are now becoming mainstream.
I know. It's
He
amazing.
uses the example of reversing type 2 diabetes
Right.
through lifestyle changes,
Yeah, that's a perfect example.
which, even a few years ago, that was kind of like,
Yeah, it was unheard of.
yeah, like woo-woo stuff.
Right.
But now it's
It's becoming much more accepted.
widely accepted, even in mainstream medical institutions.
Yeah, exactly.
That's a really great example of how quickly things can change
Absolutely.
when we start, challenging conventional wisdom and exploring these new possibilities.
And it shows that we don't have to be bound by these outdated paradigms.
Right.
We have the power to create a healthcare system that really serves the needs of patients.
That's inspiring.
It is.
To see that kind of progress, it makes you wonder what the next 12 years will hold.
I know, right?
But before we get ahead of ourselves,
Yeah.
let's delve into some of the specifics
Okay.
of how functional medicine actually works.
Let's do it.
I mean, we've talked a lot about diet,
Yeah.
but what other tools and strategies does this approach utilize?
Well, let's unpack that right after a quick break.
Okay, sounds good.
So, beyond diet, functional medicine uses a lot of different tools and strategies to optimize health.
Yeah.
And one that Dr. Cole is really passionate about is intermittent fasting.
Yeah, I've heard him talk about this before, and he sees it not as this restrictive diet,
Right.
but as a way to give our digestive systems a break,
Exactly.
and allow our bodies to kind of focus on cellular repair and rejuvenation.
Right.
But isn't that counterintuitive?
Yeah.
I mean, we're always told to eat regularly to keep our metabolism going. So how does fasting actually benefit us?
Yeah, it seems counterintuitive, but the research is showing that it actually can have a really positive impact on metabolic health.
Okay,
And it's not about starving yourself.
right.
It's about strategically timing your meals to create those periods of fasting.
Okay.
And that can help to improve insulin sensitivity, reduce inflammation,
Hmm.
even promote weight loss.
So it's more about when you eat than what you eat.
In a way, yes.
Okay.
Of course, what you eat still matters,
Right.
but the timing can have a big impact.
Okay.
And Dr. Cole actually wrote a book about this called Intuitive Fasting,
Right.
where he gives some really practical guidance on how to incorporate it into your lifestyle
Yeah.
in a way that feels good and sustainable for you.
That's great. I mean, it's not about this rigid protocol. It's
Exactly.
finding what works for you.
Exactly.
It's interesting that he's such a strong advocate for this.
Yeah,
It shows his willingness to challenge, conventional wisdom and
absolutely.
explore these alternative pathways to health.
Yeah, he's definitely walking the walk.
Yeah, he's not just talking the talk, he's living proof
Yeah,
that you can integrate these principles into a modern lifestyle.
exactly.
But it goes beyond diet and fasting, right?
Right.
What other aspects of a person's life does functional medicine consider?
Well, functional medicine practitioners look at a wide range of things that can impact health. So you've got stress levels,
Right.
sleep quality, exercise habits, environmental exposures, even social connections.
Wow, so it really is about the whole picture.
It is. It's about understanding how all these pieces fit together
Yeah.
and how they might be contributing to a person's overall well-being.
So we're not just a collection of isolated symptoms.
No.
We're complex beings
Right.
with all these interconnected systems.
Exactly.
This must require a very different approach than a typical doctor's visit.
It does. Functional medicine practitioners typically spend a lot more time with their patients,
Okay.
really diving into their health history, their lifestyle habits, their goals.
Hmm.
They use specialized testing to get a deeper understanding of a person's unique biochemistry,
Okay.
to identify any underlying balances,
Yeah.
and they work together with the patient
Okay.
to come up with a personalized plan that addresses their needs and supports their journey.
It sounds like a much more holistic and empowering approach.
It is.
But how accessible is this? I mean, is it still considered alternative or fringe?
It's true that it hasn't fully made its way into mainstream medicine yet, but it's definitely gaining traction. More and more people are seeking it out,
Okay.
and even conventional doctors are starting to incorporate some of these principles.
Okay, that's good.
And there's also a growing body of research that's really supporting the effectiveness.
That's great to hear. It seems like we're on the verge of a big change
I think so.
in how we approach health and healthcare.
Yeah.
But even if you don't have access to a functional medicine doctor, are there things that people can do on their own
Yeah.
to start incorporating these principles?
Absolutely. I mean, one of the most empowering things about functional medicine is
Hmm.
this emphasis on personal responsibility
Okay.
and self-care.
So what can people do?
Well, even small changes in your daily habits can
Yeah.
make a big difference. Dr. Cole talks about this.
Yeah.
He calls it the power of tiny hinges swinging big doors.
I love that.
Yeah.
It's such a great analogy.
It is. It reminds us we don't have to overhaul everything at once.
Right.
Right. Just small, consistent steps can lead to big changes.
So what are some tiny hinges?
Well, we've talked about diet and fasting.
Right.
But beyond that, prioritizing sleep,
Okay.
managing stress, incorporating movement into your routine.
Okay.
These are all really important.
Yeah.
Even just spending time in nature
Right.
or connecting with loved ones can have a profound impact.
It really is about this holistic approach to well-being,
Yeah,
understanding that our physical, mental, and emotional health are all connected.
they are all connected.
And it sounds like functional medicine provides a good framework
Yeah,
for understanding those connections and making informed choices
it does.
that support our overall health goals.
Exactly. And remember, this is a journey, not a destination.
Right.
There's no one size fits all.
Okay.
So it's about finding what works for you, but the key is to be proactive,
Yeah.
take ownership of your health,
Right.
and really embrace the power you have to make a difference.
It's about shifting our mindset
Yeah,
from this place of passivity to a place of empowerment,
exactly.
recognizing that we are active participants in
Yeah,
our health journey.
it's powerful.
Yeah, that is a powerful message.
It is. And as we kind of wrap up this deep dive into functional medicine,
Yeah.
I think it's worth reflecting on Dr. Cole's call to action.
Yeah, he challenges us to think differently about healthcare,
He does.
to move beyond this symptom-focused model,
Mm-hmm.
embrace a more preventative and holistic approach.
Yeah, he wants us to become informed advocates for our own health,
Mm-hmm.
seek out practitioners who are aligned with our values, and support our journey towards optimal well-being.
Right. And he also reminds us that, we don't have to have all the answers.
Right.
It's okay to ask for help, do our research, keep learning,
Absolutely.
and he leaves us with this thought-provoking question.
Yeah.
If food is such a powerful influence on our health,
Yeah.
what small changes can we make in our diet today
Mm-hmm.
to start moving towards optimal wellness?
I love that.
And it might be simple, right?
Yeah.
Swapping sugary drinks for water,
Right.
adding more vegetables to our meals,
Absolutely.
experimenting with intermittent fasting.
Yeah.
The key is to start small.
Yes.
Find what works for you and build those sustainable habits
Exactly.
that support your long-term health goals.
I think that's a great place to wrap up
Yeah.
this part of our deep
Yeah,
dive.
we've covered a lot,
We have.
but there's always more to learn.
Always.
And that's the beauty of it.
It is.
This journey of discovery never really ends.
Never.
Yeah, it really is a lifelong journey. And even though this is just kind of a snapshot of functional medicine, I feel like we've uncovered some really valuable insights. What stands out to you as the most impactful takeaway from our deep dive with Dr. Cole?
I think for me, it's the emphasis on personal empowerment. You know, his approach doesn't position you as this passive recipient of healthcare. It encourages you to be an active participant, ask questions, do your own research work collaboratively with providers to find what truly works for you. And I think that's really powerful, especially in a system that can often feel very disempowering.
Yeah, I totally agree. It's about reclaiming that agency over your own health. And it's not just about seeing a doctor who practices functional medicine. It's about embodying that mindset, in every aspect of your life.
Right.
Making conscious choices about the food you eat, how you manage your stress, the sleep that you prioritize. It's all interconnected.
And recognizing that those small changes can have a big impact, like that analogy that he uses, tiny hinges swinging big doors, really resonated with me.
Yeah.
It's a good reminder that we don't have to do everything at once.
Right.
It's those consistent daily choices that add up over time.
Absolutely. It's about building those sustainable habits that support your long-term health goals. And even though we've been talking specifically about Dr. Cole's insights,
Right.
This is really just the tip of the iceberg when it comes to functional medicine.
Absolutely.
There's a whole world of, knowledge and resources out there
For sure.
for anyone who wants to delve deeper.
Definitely. And that's what's so exciting. Hopefully this has sparked some curiosity and given you some tools to kind of start exploring.
Absolutely.
Remember, you're your own best advocate.
So as we wrap up our deep dive into the world of functional medicine with Dr. Will Cole, we just encourage you to keep that sense of curiosity alive, keep learning, keep asking questions,
Keep exploring.
and keep exploring what it means to truly thrive.
Until next time, stay well.